today we are speaking to Brock. And Brock, you've been in treatment, really not treatment, we were going to see if I could help you this week. So it was your trial week.
Yeah.
Okay, tell me a little bit about how long you've had CRPS.
I've had it about 10 months now. Came from a broken ankle back in January. And I've gone through a lot of different types of treatment up until now, but I've had it around 10 months.
Okay, and tell me a little bit about the treatments you've tried.
Well, I've had 4 sympathetic nerve blocks now, along with tons of medication, and got very little relief from any of them, really, to be honest with you. The nerve blocks helped a little bit, the first one. The second one lasted a little shorter. The third one, the fourth one was only a few hours. It was not fun.
Is it a 7-inch needle?
Yeah.
Wow.
It's a 7-inch needle and through your back to the front part of your spine. So, yeah, and I have to be awake for it with no medications, no anything. So, it's not much fun.
How do you even hold still for that?
Well, that's kind of the hard part because they tell you if you twerk, if you twitch or move or anything, it can move the needle and make the medicine go in the wrong spot, and it's really hard. Don't know if I can again. That's why I don't want to ever do that again.
And you were considering ketamine right before our paths crossed.
Yeah, I've been looking into it pretty heavily. I know that within a year is the best time to start treatment, and I have a 4-year-old son and a wife, and the ketamine is extremely dangerous and it's crazy expensive, and I just not willing to take those risks right now.
Tell me just a little bit about how this CRPS has changed your life.
In every way imaginable. I started off, I was in bed completely for about 10 weeks, and it began to spread into my other leg, and I couldn't even get out of bed. I lost my job, as many people do, I guess, with this. But I was on crutches about 7 months total. My leg drew up to, it was not much bigger than the bone. I had a little bit of calf and some thigh left, but it was basically gone. Physically, it changed everything I can do. I haven't been able to do much of anything since this happened. Emotionally and relationship-wise, it's changed me totally. When you're dealing with pain like that all the time, it just does something to your brain. It's the best way I know to describe it. It's just caused a lot of problems in every facet of my life, really.
Okay, so I linked something for you that no doctor has ever done before.
Yes.
If you know the answer to that, it's kind of a pop quiz.
Yes, I was amazed. I was talking on the phone with you, and I just told you a little bit about what I had going on, and you stopped me and said, "I bet you forgot to tell me about some type of neck injury you've had." And no one's even asked me that. No doctor that I've seen has ever even checked that out, and it was like a light bulb went off. It's like, wow, yes, I did, and yes, most of my problems did begin back then. Not the extreme like I have in the leg once I broke my ankle, but a lot of other issues were there from that point on.
We think that CRPS is like the perfect storm, and your central nervous system is injured through different ways. You could be genetically set up for it, but unless you address the problem in the central nervous system, if you're just treating the symptoms, whether you're using ketamine or spinal blocks or hydrocodone or spinal cord stimulators, you're not getting to the bottom of the problem.
Yeah.
And I think you also liked our treatment because I told you, besides losing money and time, there are no side effects.
Yeah. And I was still a little antsy when I came up here, but it's been completely painless. I've had no adverse side effects, no pains from the treatments, nothing. It's amazing.
So your pain level right now is at a what?
I'm at 0. 0.
How does that feel?
I'm smiling for the first time in a long time. I haven't been at 0 in almost a year now. So even with the nerve block, it stopped, the pain in my leg for a short time, but my overall body, it did nothing for. And I've been amazed since 5 seconds into the first treatment, I guess, I was pain-free.
I'm so excited for you.
Me too.
So we're starting your full treatment in January,
Yes,
which will last 10 weeks. And we'll certainly follow up with you guys and follow Brock. Thanks for watching.